We are back with more What's Now. What do you need to know right now as pertains to Medicare? We have some excellent information for you from Ben Kehl. Let's take a look.
Medicare's annual enrollment period is almost here, the time when millions of Americans will make important decisions about their health care coverage for next year. Whether you're enrolling in Medicare for the first time or looking to change your coverage during the annual enrollment period, which begins October 15th, Ben Kehl from UnitedHealthcare is here to help us get to know Medicare. Thanks for talking with us, Ben.
Glad to be here. Thanks for having me.
So tell me more about how and when and what people need to do to enroll in a Medicare plan.
Yeah, there's three basic times that people can enroll or change their plan. Probably the best well-known is at the age of 65, right? So what people may not know is that you have a 7-month window to actually do the enrollment. So you've got the 3 months before your birthday month, you've got the 1 month of your birthday month, and then you got the 3 months afterwards. Now, suggestion there, enroll early in that process. Don't procrastinate because you don't want to have gaps in coverage or late enrollment penalty fees. So no one likes those. So do that early. So that's number one. Number two is we're getting ready to go into that season right now, which is annual enrollment period. That runs from October 15th through December 7th. And that's for people that already have a plan, but it's the time of year where you can review your plan. And if your circumstances have changed, you need to find something different, you can make those changes, coming up here shortly. And then the last one that's probably not as well known is that you can have qualifying life events that you can also then change your Medicare plan. The best example I like to give is if people move. So those are sort of the three basic times of people's lives where they can enroll in Medicare.
And what are the most important things to consider when enrolling in a Medicare plan?
Yeah, there's so much that you can consider and should consider. And the other good news is Medicare is not a one-size-fits-all, right? There's a lot of great options for people to consider. But in my experience and in talking to our members, I'd say there's three basic things people should pay close attention to. The first is the budget part of their plan, right? Does this work for my budget? And most people will look at the premium. That's the amount that you pay every month for your insurance. But what people don't often spend as much time in is the cost of using the actual care part of it, right? So the co-pays, the co-insurance, the deductibles, you need to look at both of those equations to understand the budget implications for your plan that you're looking at. So that's number one. Number two would be the network, right? Most people want to see the doctor or doctors that they already see. And so making sure those doctors are on the health plans directory is also a good idea. And then the last one I would have people pay close attention to is the prescription drug coverage. So people often are on drugs, and so making sure that those drugs specifically are on the formulary or the approved drug list. And also people should know that can change year over year. So always a good idea to make sure that nothing's changed because you don't want that kind of surprise come January 1st.
And there's different parts of Medicare, Part A, Part B. What does that mean?
Yeah, it's alphabet soup, A, B, C, D, E, F, or you're going back to the eye doctor, right? So A and B, I'll start there. That's original Medicare. That's the plan that's offered through the government. And that A covers things like inpatient care, hospice, skilled nursing facilities. So that's A. And then B is more for the day-to-day type of care, going to your primary care doctor, outpatient services, preventative care, things of that nature. So A and B together make up original Medicare. Part C is better known as Medicare Advantage, and that takes Part A and Part B, puts them together in one plan, and that plan is offered through a private health insurer. So not the government, but a private health insurer. And what you get with a Medicare Advantage plan is other things that original Medicare doesn't cover. Things like prescription drugs, things like dental and vision, even things like, for my mom, I know my mom loves to go to the gym. You can even go to the gym for free with many plans. And so you get some extras that come with Part C or Medicare Advantage. And then finally, Part D is probably the easiest for people to remember. D stands for drugs. So that's a prescription drug only plan as well.
And how can people learn more about Medicare? Because there's also a difference between original Medicare and Medicare Advantage.
Yeah, I mean, all those things, even Medicare Supplement, which we did talk about a lot. But the best advice I'd give people is to talk to somebody about this. Many communities will have local events or local agents that are very familiar with Medicare. There's a website that I like to promote people to go to visit, which is gettoknowmedicare.com. Again, that's gettoknowmedicare.com. And there you can find those local events, webinars, local agents to talk to about it. But there's also some really good things like videos and organizers that really just take the topic and break it down into plain English. So it's a great place to get started, and it's got connections to a lot of other great resources.
And how can people get coverage for their medications?
Yeah, so the two basic ways that they can do that is one through a Medicare Advantage plan, so Part C, or through the Part D plan, which is prescription drug only.
And where can we get more information? What else can we do to continue this conversation on our own?
Yeah, I think the getknowmedicare.com is a great place to start, and that will connect you with live people if you want to talk to somebody, or great resources to learn more.
Well, thank you so much, Ben Kehl, for joining us today and helping walk us through this important time. We appreciate it.
My pleasure. Thanks for having me.